Hello everybody, this is Arifa from Toronto. Our website is www.eawaz.com. This segment is designed and prepared by Dr. Leeds, Dr. Anthony Leeds, all the way in England, London. Dr. Leeds is a doctor, he's a researcher, and he is working on obesity and the problems related to obesity, especially diabetes. And you must have seen our other programs. Today we have another wonderful guest with us, and I'll introduce that. Our topic today is diabetes remission. Studies in UK and Qatar showed that this can be achieved in Europeans and people of North Africa and Middle Eastern descent. With Dr. Anthony Leeds in London, we have a Professor Mike Lean from the University of Glasgow, speaking from Scotland. So this is Canada, we are in England, and we are in Scotland as well. They will discuss the issue that they believe to be important for our audience. When I introduce Dr. Michael Lean, Dr. Michael Lean is a university professor of human nutrition and consultant specialist looking after diabetes patients in Glasgow Royal Infirmary in Scotland. World Authority on Obesity and Diabetes Research for the treatment and the prevention. Leader of the world's first diabetes remission trial called DIRECT, which showed that 9 out of the 10 people with the diabetes could get rid of the diabetes by diet and weight loss. It will be a great show, and I believe our today's show will be in 2 episodes. First of all, I would like to welcome my wonderful guest, and that is Dr. Anthony Leeds. Dr. Leeds, I welcome you to the show. Thank you for being with us.
Yeah, thank you. I would like to thank Mike Lean for joining us this afternoon, because what we're going to talk about is something which is extremely important. He's been involved for many years now in the trials which are taking place in Glasgow and Newcastle, and has also been guiding others in other parts of the world on this particular important topic. What we should do before we describe the very exciting results that have been found is to consider what we're actually meaning when we talk about diabetes remission. So, Mike, can we begin by introducing the topic by saying what is meant by diabetes remission?
Yeah, thanks, Tony. This idea, this sort of concept of a remission of diabetes is very new. And I was taught as a doctor that permanence of diabetes, once you have the diagnosis, that is permanent and you will live with it and it will be progressive. And as my career went on, I realized that there were some people who were able to get rid of their diabetes. And just by observation, it was clear that these were people who made a big effort and who were overweight and who managed to lose that weight. And so we postulated that actually this is a reversible disease, or at least that it could be put into the state that it was before it was identified as diabetes. So we think probably that people have a predisposition to this disease, which is then revealed as they get older and put on weight, but that we can turn back, if you like, turn back the clock as far as the weight goes. And what we mean by a remission is that somebody who has become diabetic, has type 2 diabetes, abnormal tests, if they have weight, they can then get back completely normal tests, no longer diabetic, without requiring drugs, medication. And we believe that that reverses the whole disease process so that they should be protected and should not then get the complications of diabetes. Explain it.
Okay, thank you. So, do you think that there were any clues about this before? Because I'd heard other physicians 20 or 30 years ago saying that occasionally, if they'd seen an individual who could manage to lose weight by conventional means, and this is before the introduction of bariatric surgery, that they also were able to achieve remission for some time. So we've had some clues for quite a long time, haven't we? Do you think, or not?
Oh yes, I mean, I think many of us have observed patients over many years who have managed to do this. And I suppose, out of fairness to the bariatric surgeons, they did ultimately prove that one could get a chemical normality after substantial weight loss. The exciting thing, though, was that when I went back and analyzed the data published by the bariatric surgeons, and of course they're looking for enormous weight losses, 30, 40, 50 kilograms. But it was clear that by losing 15 kilograms, all that reversal of diabetes already. So you didn't lose 30, 40, 50 kilograms. You had to lose about 15 kilograms. Now that's not easy. Not everybody can do it. Certainly not everybody can do it on their own. But it becomes possible with support, with help, and looking into the future potentially with medication, although we have not used medication for this. It is possible with good dietitians, good diet, to get a 15 kilogram weight loss. And that, we discovered, removed the diabetes from almost 9 out of 10 patients. So the great majority of diabetes is reversible.
Wow.
Weight loss. What actually happens within the body?
Well, when people lose weight, and we're talking here, it's important to recognize this is intentional weight loss, with good support. It's not losing weight because you're sick, and that's a very different kettle of fish. When people lose weight because they're ill, they tend to lose muscle, they feel weak, and they are often becoming very ill. So losing weight intentionally loses the stored calories, the fat that we've put away and stored. And that, in most cases, is the fat that we can sort of feel under the skin. It's the graspable fat. But people with diabetes have a different distribution of fat. So they put more of the fat which is stored with age and gaining weight. They put more of that fat into the internal organs. So people with type 2 diabetes have a lot of fat in the liver. They have a lot of fat within the abdomen, and they have a lot of fat, as we now know, in the heart and in the pancreas. And of course, that fat is doing damage. It's doing damage to the liver, which then puts out more glucose, more sugar into the bloodstream. It does damage to the heart and to other muscles, which means that they don't take up the sugar, they don't use the sugar normally, and they accumulate more fat, and that damages the cells in these organs. And it damages the pancreas, so that a fatty pancreas no longer produces insulin in the normal way. And so when people lose weight, the important thing is to lose the fat. We call it ectopic fat. It's fat in the wrong place. You lose that fat in the liver, lose the fat from the pancreas, lose the fat from the heart, which is the damaging fat, which is upsetting and damaging these organ functions. And we've discovered that happens quite quickly during weight loss. With a loss of around 10 or 15 kilograms, nearly all of that excess fat has gone. And that's very exciting, because it does make this possible for many, many people. If you understand how serious, what a terrifying disease type 2 diabetes is, then making the big effort to lose 10, 15 kilograms really is worthwhile.
Yeah. Can you tell us a little bit about how people do achieve that large weight loss? Because most individuals listening may well have tried to lose weight by conventional means, a conventional diet, and they will have lost a few kilograms or a few pounds and then found that they gradually regained it. So there are quite a lot of challenges. The first one is, how do you achieve that much weight loss in the first place? And then secondly, once you've done that, how do you maintain it? Now, I know you've got teams of people who've been working on this around Glasgow and then also around Newcastle. Can you explain a little bit about how this is achieved?
Yes, you're absolutely right. Most people who've got a weight problem, especially those who develop complications like type 2 diabetes, they know they've got a problem. The great majority have made an effort. They have tried to lose weight. A lot of them have lost weight, and some of them quite a lot of weight, but they tend to put it on. And one of the reasons for that is losing weight is hard work. There's no way around this. We can help. We can make it a bit easier. We can give support, and we can recommend, the best approaches to do it most effectively. But it is hard work. And if you're on your own and you're trying to lose weight without a lot of support, there isn't much to show for it. If you lose, 5 kilograms, even 10 kilograms, there isn't a huge lot to show for it. But once you lose 15 kilograms, people notice. You feel better, you feel lighter. And unlike losing weight from illness, where if you lose 15 kilograms because you are overweight and you've got too much fat, you actually feel stronger. So quality of life gets better. People feel better about themselves. They get positive feedback. So I think it's been really important to us to recognize that losing the weight really as quickly as possible, safely, using a properly designed, nutritionally appropriate and complete diet, that's the best way to do it. Now that's again a new thing, because for generations dietitians and doctors have often said, oh, if you lose the weight quickly, you'll put it on quickly. Now that just isn't true. It's a myth. And I'm very glad we've been able to produce evidence, and not only us, but others in other countries have produced equally good evidence, in particularly, I think your colleagues in Denmark have done a wonderful job here, showing that if people can lose the weight quickly, and we're talking here over, let's say, 3 months, I don't mean over a fortnight, it takes about 3 months to lose the 15 to 20 kilograms, using a well-designed diet with support. That is the best way to get people into a position where they can keep it off long term.
Yep.
And then we're beginning to recognize how we must approach the weight loss phase, inducing the weight loss or inducing a remission, maybe quite a different exercise from maintaining that weight loss in the long term. So we really two different approaches which have to work one after the other.
Yes. What we should say, of course, is that the way that people lost that amount of weight in your trials was using a formula diet program. So they had soups and shakes only for the period of time that they needed to follow it. Others have tried to do this with whole foods and have achieved it fairly successfully in some cases, but perhaps a smaller proportion of people by comparison. Do you want to comment on that? Because I think it's very difficult to manage that with
we compared, we did a little comparison at the beginning to see whether people preferred to use a formula diet. And these are a formula, they come as a sachet which you make up as drinks, as either fruit flavored or sort of vegetable soup sachets. And so you simply make them up and consume the packet. Or to do the same sort of thing with a similar number of calories made up from foods and quite simple foods around the house. Now, we thought there'd be quite a few people who would prefer to do it with foods, but no, the answer was that our patients who managed to get themselves seriously overweight and diabetic did actually find it easier to follow the instructions. It was safer for them. They didn't feel that they were having to make decisions about how much of this and how much of that to have. They were tempted. The sachets, they taste okay, but you don't go back for a second helping. So they weren't tempted to overeat during the weight loss phase. And they found that they were best suited to getting rid of that extra weight as quickly as possible, safely using nutritionally complete formula, using the made up formula diets. And I think it is important we can stress to our patients, this is nutritionally complete. It's entirely safe. All the vitamins, all the minerals are there. You'll be entirely safe doing this for 3 months, up to 3 months. And some patients are able to get that weight off more quickly. They can do it in 10 weeks rather than 12 weeks, but it takes approximately that long to do it safe.
Yeah. Did you find that men tend to lose weight more quickly than women and perhaps end up losing slightly more weight at the end?
Yes, men tend to be a bit bigger than women, and so their metabolic rates tend to be a bit higher. So if you give them the same number of calories, and in this study, we gave everybody the same number of calories from the formula diet, then men will lose weight a little bit more rapidly, and they will get a slightly more rapid improvement in their diabetes.
Yes. Was there a figure for how many people managed to complete the program? Because one of the figures that I quote is that the preview study on pre-diabetic individuals, where there were 2,200 and some people who started an 8-week total diet replacement, 91% of them actually managed the 8-week program, which I think is a remarkably good outcome. What was the percentage of people who started your programs who managed to go through and who therefore didn't drop out? In other words, what was the dropout rate?
It was very low indeed. I think I'm right in saying that there were only about 7 patients who dropped out from 150 before we got results in that phase. Now, they didn't all do equally well, but they didn't drop out. So out of 150 patients who started the program, we had data on 147, of whom about 4 out of the 147 basically had done very little. For complicated social reasons, things went wrong in the family, and it just wasn't the right time for them to do this. But the huge majority, so we're talking over 90%, were able to complete the program and get some weight loss. Not all to the same degree. The average weight loss was 14.5 kilograms. So they didn't all get more than 15, but they came close to it. And those who lost less than 15, did reasonably well.
Right at the beginning, when people were offered this type of option, how many of them actually accepted it, and were there a small proportion who declined it even before they'd started? Because I've heard others say that this is an option that is only going to be taken up by about 20% of people, but I'm not sure that that's right based on my observations and other trials. I think only a tiny percentage refuse an option of this type. That's my impression.
You're quite right. The attraction. I mean, this is a big lure. People with diabetes, they're faced with a disease which is at least as serious as a major cancer. The life expectancy with type 2 diabetes is worse than breast cancer. It's similar to a lymphoma. You know, this is like a serious cancer. And if you're given the opportunity for treatment to get a remission from your cancer, you're going to almost 100% will say yes. There's a good chance of a remission.
Yeah.
I will go for a remission. Yeah. So same thing. If we offer people the chance of a remission from their diabetes, and they understand what diabetes is and what type 2 diabetes will do to them, remission is a very big lure. Also, this is the thing, people don't like taking medication. They really prefer not to take medication if they can be healthy without it. So that's good common sense. So the huge majority of people, we went into practice and invited people to do this trial, and we invited them and told them what it would entail, which is quite frequent visits at that time. We now do it all online, but at that time it was quite frequent visits into hospital to be checked and measured, and into their surgery to be checked and measured. And it was quite a big undertaking, and they agreed to do it. The great majority of people who we approached, provided they were going to be in the country and they didn't have other things going on, they said yes. So we had an uptake rate of around about 30%. Now that's much higher than you would usually get for asking people to do medical research in primary care. We did this entire study in primary care, so nobody came into hospital. They were all seen by their practice nurse or a dietitian if there was a dietitian available. They were done, in their own villages around the country, and that was a huge response rate. So it just shows how attractive this was to people with diabetes. Even though
now one of the comments I've also heard people say in different parts of the world is, well, this is all very well, you're giving it to Europeans who are used to all sorts of strange food options, but when we offer this to people in our country, they're not going to find it acceptable. Now, Sharad Trahiri has just completed and reported last year the first one-year results of a similar study in Qatar on people from North Africa and the Middle East, and seemed to get very, very good results. Do you have any comments about the issue of the acceptability that we might anticipate for this type of program in South Asia, Southeast Asia, for example, as well? What do you think would be the effect? What would be the attitude?
Lots of ideas attached to that, and you're right. Sharad Tahiri has had wonderful results in Qatar. They had 60% remissions from the overall program at 1 year, which is at least as good as ours. They were people with diabetes for only 2 years, so a very good window. Now, we had patients much longer. The chances are, from what we understand about type 2 diabetes in people with Asian origins, is the disease course tends to be quicker, and it comes on earlier, at a lower body mass index or a lower level of fatness. So we believe, and we haven't got final data on this, that people from Middle East or from Asia are likely to do even better than our European patients with similar degrees of weight loss. Now, we have a small pilot study which is still ongoing in Glasgow. People they're mostly Pakistani people, but I think they're all Pakistani people from Glasgow, mostly second generation. And these are people with type 2 diabetes, which has come on younger, at a lower body mass index, exactly the same as in Pakistan or elsewhere in Asia. And we're seeing remissions with weight losses of nearer the 10 kilograms than 15. It's a very small study, and I wouldn't like to extrapolate too widely, but I think we're going to see equally good results, if not better. However, we don't know how long those remissions will persist. Now, we know in our European people in DIRECT that if people were able to lose 15 kilograms, it was over 8 out of 10 in remission at 1 year and at 2 years. So it's persisted very well for at least 2 years, and we're now looking at data up to 5 years. It's going to be really important for the people from Asia to see how long their remissions last, bearing in mind that the disease course is often more rapid. Now, the other question you asked about how acceptable it is very interesting, because at the first invitation European people with diabetes were very keen to do this study. The Asians were more reluctant because they believed, and this is it's an interesting observation, they believed that losing weight would make them feel weak. Now, this is a very common belief amongst Asian people, that losing weight, and of course that reflects what happens if you lose weight because you're ill. If you lose weight because you're ill, then you lose muscle and you will get weak. On the other hand, if you lose weight because you are making a big effort, you're using a proper nutritionally balanced diet, then you will feel stronger. And so we found a lag phase, and we did another pilot study in Kuwait, and we found exactly the same phenomenon, whereby people were reluctant. They had been brought up there to be much more trusting in the multiple drugs, and they seemed to go in for a lot of drugs, which didn't make them feel any stronger. But those who actually took the initiative and said, right, we'll give this a go, did actually feel stronger after losing some of the excess weight.
Yeah. Now, one of the other things you mentioned, of course, is the reduction of use of medications. But also, this doesn't just apply to diabetes medications, it applies to blood pressure medications as well, doesn't it? Because you've got some very big changes there as well.
Professor Leeds, you're up to speed here with the very latest results we've got from Direct. Yes, you're absolutely right. We found that in the course of this Direct trial, over 2 years, the use of medication for diabetes was enormously less. There were very few patients who went back onto medication at all. Those who did need medication required very little. And it was the same with blood pressure. Now, if people lose weight, blood pressures fall. And we know, and that applies to everybody, whatever your blood pressure, it will fall if you lose weight with a good diet. And blood pressure falls really quite a long way, by about 10 millimeters of mercury on average. People who are not on medication, if people are on medication and go onto a very strict diet and are losing a lot of weight, their blood pressures can fall precipitously, and actually that can be quite dangerous. They can black out and injure themselves even. So indirect, what we did was we said that on day one, to start this diet program, you must stop your medication for diabetes, all of it, and you must stop your medication for blood pressure, all of them. And some of these patients were on 2 or 3 different drugs for the blood pressure. We stopped all of them. We measured the blood pressures, and what happened was blood pressure started to fall, even in those who had been on 2 and 3 different medications for the blood pressure. At the end of the trial, as people's weights then balanced out and they leveled out, some of them did require to go back onto blood pressure medication, but again, fewer drugs and less side effects from those drugs. So they were very pleased. The blood pressures were greatly improved, and there was a lesser requirement for medication at the end of it. This all adds up to lesser costs. Now, whoever's paying for healthcare in the UK, our government's place, our taxpayers, we pay for everybody's health. And so putting in place a program like this actually reduces the amount of money that our health service has to spend on people with diabetes and high blood pressure. If they're paying for the medication themselves, this can work out to be really quite a big cost over many years, because type 2 diabetes, if you don't get a remission, will go on for the rest of your life. And the drug costs tend to increase, firstly because you're needing more drugs, and secondly because the drugs get more and more expensive. Hypertension is the most expensive single disease treated by our health service, and it's probably the same in Canada and possibly the same in Pakistan. I don't know that. Very expensive diseases, and we can get around them by losing weight and keeping the weight off. The critical thing is to lose weight and keep it off.
Dr. Anthony, we have to take time off now, because we will definitely continue it in the next segment. But Dr. Leeds, my question over here, you said one thing, that the Asians are a bit reluctant in losing the weight. They think that it shows their weakness. But it's very strange when Dr. Leeds even told me in the beginning, remission of diabetes, because as an Asian, it's our understanding that diabetes, of course, the malfunctioning of our pancreas. Now, these cells which produce insulin, they damage and they cannot, they don't have regeneration in them. So, once we are talking about remission, this means those islets of Langerhans are regenerated?
Mike, You should answer this one.
Later on this, and my colleague Roy Taylor in Newcastle, together we've published several papers now which have shown that when the fat, the excess body fat which is stored in the pancreas, when that falls, the islets of Langerhans start to produce insulin again.
Wow.
And as you probably know, if you take food, your insulin production has an immediate peak. Just as soon as the food is there, it has a quick peak. Now that is lost in people with diabetes completely, and none of the drugs that are available can put it back. However, that comes back. That comes back over about 6 weeks. Comes back to be the same as it was before they were diabetic, and over a year, the pancreas regenerates not only to be able to produce the same insulin as somebody without diabetes, but also the shape of the pancreas. The pancreas, we can image it with magnetic resonance imaging. And a person with type 2 diabetes, the pancreas is shriveled up, it's small, it's ragged, it just looks like a useless pancreas, which it is. Over 1 year, pancreas fills back up, the beta cells in the islets of Langerhans function again, and on the MRI scan, that pancreas looks exactly the same as a normal pancreas again.
Wow.
So it seems to be entirely reversible. And this is entirely new. This was published only last year. This is very new information.
It's a very new information, to be honest. I never thought that some cells, we thought these cells are, or we were taught that these cells are degenerated, and this is a new thing for us anyways. Dr. Leeds, we will continue it next week. Till that time, we'll say goodbye to everybody.
Yeah. Bye-bye. Thank you, Mike.
All right.